We begin tonight looking at the flu. Cases are skyrocketing compared to past years and earlier than usual. In our top story this Tuesday, Brian Burns spoke with local health officials to find out what is causing the spike.
We were washing our hands, we were wearing a mask, we were more proactive whenever it came to being sick, not going to somebody else's house. And we informed people that were coming to visit us, like, maybe right now is not a good time because I'm not feeling very well.
Assistant Public Health Director Dante Gonzalez is explaining an explosion of flu case reports in October, more than 2 months earlier than normal for the peak of flu season.
This flu season, it took us kind of by surprise that we saw 500 cases the first week. The second week, we saw 600 cases. The third week, we saw more cases. And then this past reporting week, we saw 1,100 cases of flu.
The numbers from Driscoll Children's Hospital are equally alarming.
Last week, we had about 180 positive children. I mean, not all of those were hospitalized, but we saw in the emergency room, in the clinic, and somewhere in the hospital. But 180 positive cases a week, that is a very large number.
Dr. Jaime Fergie says right now it's sick children spreading the virus to other children, mainly at school.
You can get very sick. I have patients in the hospital right now, very sick. I have children in intensive care unit, critically ill, perfectly healthy before, critically ill now with influenza. A lot of people were waiting to get vaccinated, and the season came early. So you cannot wait any longer. We have a very large number of flu cases here in Corpus Christi, in South Texas. Actually, the whole state is what we call red state when you look at the map from the CDC.
Dr. Fergie says despite the hardship this can cause parents, sick kids need to be kept at home. Brian Burns, 3 News.
Thank you, Brian. And many